American healthcare is a complex system. To properly function, it requires a myriad of interworking components, from hospital infrastructure to insurance companies and drug researchers. But the most critical element cannot be built or tested in a laboratory. It is the men and women who make the system run. General practitioners are the backbone of the medical field. They offer basic care and are responsible for half of all patient visits. But in many parts of the country, these small business practices are becoming an endangered species. Today, we will examine the current physician workforce shortage and discuss its potential impact on healthcare reform. This issue is of particular concern to our committee, and not just because most general practices are small firms. For one, it affects doctors in all areas, from surgeons to pediatricians. Physician shortfalls also hinder our efforts to control costs for entrepreneurs and have the potential to undermine our work towards universal coverage. In overhauling health care, we're looking to provide coverage that is both affordable and accessible. But we cannot do that without the necessary workforce. In the last decade, the availability of doctors has dropped off considerably, even for those with gold-plated policies. If current trends continue, the gap between supply and demand may reach 125,000 by the year 2025. Fewer physicians mean longer lines in waiting rooms, greater difficulties scheduling appointments, and less time with the doctors themselves. These challenges are more than an inconvenience. Some patients may choose to avoid checkups altogether. That will be a dangerous consequence, one that could blunt the benefits of universal coverage and drive up costs over time. Primary care is preventative care and an effective means for reining in costs. That is because a person who gets regular checkups is less likely to develop serious conditions down the road. And considering that 75% of healthcare expenditures go towards treating chronic illnesses, primary care is critical. The current physician shortage is already posing a significant threat to reform. Reform will bring more uninsured Americans into the fold, but it will not create more doctors to treat them. Take the 46 million newly insured, add an aging baby boomer population, and that could be very well a recipe for disaster. As with anything related to healthcare, there's no silver bullet solution. Still, a number of possible fixes are under consideration, including provisions to expand health services in underserved communities, the region suffering most from the current shortage. This body will soon take steps to transform our broken healthcare system. I think most of us will agree that it is about time. But in moving towards reform, we need to be sure our foundation is strong. It is critical that we have a solid pool of medical professionals to see the process through. Today, I hope we can look for ways to make that happen. I would like to thank all of today's witnesses in advance for the testimony, and I am so pleased that they could join us and look forward to hearing from all of you. And let me say the hearing was scheduled to start at 10, but the Small Business Committee have a bill on the floor, and they sent a late note last night that we needed to be much earlier. With that, I will yield to Ranking Member Graves for his opening statement.